Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Asani Cayetano.
And thank you for joining us this morning. All right, we're going to jump right into our weather update for today. We have Michael Gentle on the line. Good morning.
Yes, good morning.
How are you today?
I'm doing okay.
All right, and the rest of us, we're just trying to stay cool. Michael, tell us what's happening with the weather.
Hot and a bit unstable. We're expecting temperatures to reach 91 along the coast, 100 degrees inland again, and about 86 in the hills.
And
We have both the advisories. We maintain the advisories for the heat advisory for inland areas, and also for the high risk for forest fires around the country.
yeah. And you mentioned unstable. Does that mean some areas will be seeing some showers as well?
We expect showers to be generally isolated, but we can expect isolated thunderstorms over inland and the higher elevations this afternoon, and likely to occur over the south tonight.
Okay. And are the winds going to be helping to cool us down a bit?
Winds fairly light across the coast, 5 to 15 knots, choppy sea conditions at most.
All right. All right, let's get the details of those temperatures again then.
Okay, we're expecting 91 degrees Fahrenheit along the coast, 100 degrees inland, 86 in the hills. Even nighttime temperatures are a bit warmer. We expect 84 along the coast, 77 inland, and 72 at the high elevations.
And it does, I mean, it seems it has been hot for quite a while, but it does feel especially hot these past few days. Is there anything that's affecting our weather?
We have southerly winds, southerly to southeasterly winds between the surface and 10,000 feet. So the southerly component transport the heat from over the land areas to the south of us.
Okay. All right, and any changes in the next few days?
We expect similar conditions for tomorrow with isolated showers, isolated thunderstorms over inland and southern areas. But we are likely to see a bit more showers for Thursday. We're seeing a tropical wave on the charts, but showers, we see the showers will be after the wave passes.
Okay. And we'd expect that on Thursday, you said?
Thursday, yeah, we should see a bit more showers for Thursday.
All right. Well, thank you very much for that update.
Okay, welcome.
You have a great day. Stay cool.
Thank you. Yeah, sure.
Yeah.
Last night was brutal.
It's hard to start a conversation today without saying it's hot. And it's hot from early morning when you wake up, when you go to bed, as you're saying. So, you know, I do appreciate that the Met Service does offer a very important reminder, which is stay out of the sun if you can, and most importantly, stay hydrated. Drink water even when you don't feel like it.
It's easy to become dehydrated during this time because while we may not be as active, we forget that we need to be drinking a certain amount of water for the day to remain fully hydrated, right? What is it, like the 8 glasses or something?
Yeah, it's 8 glasses, but I think that especially for people who are older and the young children, they don't necessarily recognize thirst as easily, and so it's important for you to check on them and make sure they're consuming enough water or fluids.
Yeah.
All right, and we're going to get moving into our eye opener for this morning, a bit of motivation to get us started on this Tuesday, the start of the week. And our eye opener taken from dailyom.com goes like this. We all have to do things in our life that we don't want to do. And the easiest solution is to change our attitude. We all have days when we're faced with chores, errands, or responsibilities that we don't want to do. At times like these, it's easy to get into a bad mood and stay in one as we tackle these tasks. However, given the fact that our bad mood will not change the fact that we have to do these things and will most likely make things worse, we could also try to shift our attitude. Many wise people have pointed out that it is not so much what we do as it is how we do it that makes the difference in our lives. The more supported we feel, the easier it is to open our minds to the idea that we could change our way of looking at the situation. In truth, most of the chores we don't like doing are intimately intertwined with our blessings. Any task can be transformed from a burden to a necessary aspect of caring for someone we love. All we have to do is shift our perspective, and our attitude follows shortly behind.
This is a really good one.
I'd say perfect for starting the week.
I'll draw on an experience that I had last year, perhaps around this time, quite honestly. You would recall that in my capacity as a reporter, I had traveled down to Machakilha to do the first leg of the PSC exams last year. And it just so happened that it wasn't something that I was excited about, given all the last minute changes and what have you. And I never really, for whatever reason, cared to take on the assignment. And so going into it, there was sort of this mood or this attitude that whatever. But getting there and changing my attitude towards doing it turned out to be a well-received story, because I ended up going above and beyond based on the fact that I changed my attitude and my outlook towards doing it. And so it's just one of those examples that I immediately draw on. Looking at the eye-opener, however, speaks to that, because it's always a matter of an attitude. There are many things in life that we don't want to do, we don't want to encounter, we don't want to have anything to do with, but we're faced with having to deal with these issues or situations. And so it has to do with our perspective. If you're faced with something that you may not be fond of, then you just have to change the way you approach it, so that while, yes, you may not be, the happiest, at least you're approaching it with a clear mind so that you know what the outcome will be. That's what I take from the eye-opener.
It came to mind to me, because I spend a lot of time with the little ones in my family this weekend. Just the blessing that we have as adults in being able to regulate our own behavior and our own attitudes. When a child says, I don't want to, you're going to face quite a battle to get them to do it, whether it's brush their teeth or
take a bath, whatever it is.
Chores, whatever it is. Because in their mind, they just know they don't want to do it, and you have a big fight immediately after. But the difference is, as an adult, we still have that feeling. We still hear of something, know we have to do something, maybe it's housework,
kicking
maybe
and
it's
screaming.
actual work, and internally we're ready to throw that 2-year-old tantrum, like, I just don't want to do it. But we can and we have to. And the difference with being able to recognize it just when you look at it differently. I really don't want to do laundry, but it has to get done. I really don't want to take on this assignment, or I really don't want to do this particular aspect of my job, but I know I have to. Now, am I going to do it and be miserable from the beginning to the end? Or am I just going to perhaps change the way I look at it and make it a lot more bearable for everyone?
It changes the experience too, though, because going into something where you're not, the most excited to do it, it reflects in more ways than one, right? The outcome is directly affected by how you come into the situation, right? And so that if you come in miserable and kicking and screaming, then you won't be putting your whole heart and soul, as we'd say, into doing it or resolving it or getting it done, right? But if you approach it and say, you know what, let me make the best of a bad situation, then that in itself kind of translates to what you do and how well you're able to do it.
And I love the tip that the eye opener offers. See the blessing in it. You
Yeah.
know, let's say it's dealing with something with your car, you know, and you really don't want to do it. If you take a moment to recognize the blessing that you do, that you are mobile, that you do have a vehicle, that you can take it to get serviced or checked or fixed or whatever, there's a huge blessing in that. It's in this day and age, if it's something at work, where we know that a lot of people are facing unemployment, this is such a key time to be able to say, well, you know what, I'm
You get up and go to work.
grateful that I have work.
Yeah.
Because imagine those who'd love to be having a nasty day at work because they're not employed.
Yeah.
So sometimes when you shift how you see what you're about to do, it really makes a difference. And it's one of those Monday mornings. I know it's Tuesday, but it's the start of the week, and it's just one of those days where you have to shake off the long week and get yourself back into the mode. So we're feeling a lot of this. Like, I don't want to do it. But find your blessings and change your perspective. You don't have to have a bad day. You just have to change a bad mood.
Well said.
Right. So that's the eye opener for this morning. I think I needed that one too. All right. We're going to get into the eye on the news for today. It was a 3-day weekend, and we're going to see what's the big news coming out from the weekend and in the week ahead.
All right, so Friday evening, I had a conversation with the Chief Executive Officer of the Ministry of Foreign Affairs, CEO Luan Burns, who was making last-minute preparations for the arrival of a cruise ship with the first set of Belizean repatriates, right? You would remember that there were several Belizeans who were out at sea. You know, with the whole cruise tourism aspect of our economy, a lot of Belizeans are now finding work not only as tour operators and tour guides on mainland. You also have persons who are working at Harvest Key, for instance. You also have persons who are working on board these cruise ships. And so for the past 72 days prior to Saturday morning, we had a group of Belizeans who were on board a Royal Caribbean cruise ship who were out at sea. And it's quite an interesting thing because they were basically out of human contact, so to speak, right? And so they came back into Belizean waters on Saturday morning, in the early part of the morning. And there was an entire process in terms of getting them safely back onto land. And so, like around 7 o'clock or thereabout, the ship moored off the coast a couple miles out in the channel. And the protocol, if I may, in terms of the security to ensure that these persons were disembarked safely and brought onto land. So the police officers cordoned off a part of Marine Parade all the way up by Fort George, and they cordoned off the area near the Baron Bliss Lighthouse as well, right? So you had customs, you had immigration, you had police, BDF, the full gamut of law enforcement out there on Saturday morning. And there was sort of, it's a unique, let me describe it as such. It was a unique experience in the sense that it's the first time I, as a reporter, saw something like this taking place, right? You didn't have people with hazmat suits on or what have you, but in terms of the detail and the way how this was done was quite an experience to behold. And so you had these Belizeans who, as I mentioned, worked on the cruise ship in various capacities. You have a DJ, you have a waiter, you have different persons. And so they came off and they were greeted by the general manager for the Radisson, where they have been sequestered for the next 14 days, if I'm not mistaken, right? And so there was this sort of welcoming committee. The BDF held a briefing with them as well in terms of the fact that they will be providing security in and around the area based on the quarantine protocols as well.
Yeah, it's a mandatory quarantine.
Yeah. Right? And so this is what we're looking at, this entire arrival of these Belizeans on Saturday morning. What we also have, Marlene, is an interview with one of the individuals. Now, while the quarantine is mandatory, these individuals, as I had mentioned, were out at sea for 72 days. They were not in any physical contact with anybody else outside of the crew members and those persons on board the vessel itself. So it was somewhat of a form of quarantine or isolation in and of itself.
I'm glad you mentioned that. I think, you know, we had a conversation with Linda Blees, who was on one of the ships last week, and I think that it was really interesting to kind of hear the process. And it makes me so happy to see them return. These are Belizeans. You know,
they were in high spirits too, by the way.
Over 2 months on water, that's a lot, you know. I thought they would kiss the ground when they come out, because there was a lot of uncertainty around it as well. You know, the application form for the repatriation went up online on Tuesday. So it was a really limited window for them to be able to kind of fill out everything and get it in. But the story behind the cruise crew has been one that globally has been getting a lot of attention. They're just ships kind of floating out at sea with crew members that have had a difficult time taking nationals home to their home country. And some have faced different conditions on different ships. In fact, there are reported suicides of cruise members in other parts of the world where they just get so frustrated, they literally jump off the ship. Thankfully, none of our Belizeans seem to have had such challenging conditions. They were given proper rooms to be able to isolate in. But it is a mentally taxing experience.
You have to have some level of soundness to be able to endure that period of time out at sea. Now, speaking of soundness, what I can say, based on the interview you're about to see, is that they were afforded the use of the Wi-Fi, so they were in contact, constant contact with family members and friends and what have you. And I believe that is one of the key things that, you know, made them feel, you know, well, we're still in touch, so to speak. Let's go to an interview that I conducted with one of the Belizean passengers, if I may, at this point. Let's see what he has to say.
For me, it's the information that it may sounds like when we watch Facebooks and stuff, like it sounds like we were captured or something like that. That's the information that I was getting, but to me it wasn't nothing like that. Actually, being on board, they give us everything we needed. There on my ship, there wasn't anybody that actually had the COVID-19 on board. Everybody we haven't touched land for the next 72 days since we haven't touched land. Our ship was basically just in the Caribbean. We were off the coast of Tampa, Florida. So nobody touched land. There was nothing came on board. We just stopped, pick up food. Everything was actually pretty good. But I just feel really good for the back on land because we haven't been on land for a long certain period of while. So for me, I just feel glad. That's my happiest moment for just touched land. And so far as we came back to Belize, to me, it seems like Belize have really improved most of the stuff that they've been doing. They make sure that they sanitize the boat before they came. So to me, I think that they've been on top of everything. Even being here in the Radisson right now, like we're not treating like we were a disease. We're treating more like you guys are family. You guys belong here. This is where you're from. This is where you should be.
Have you been able to contact your family and your friends since arriving in Belize?
We always had Wi-Fi on board. Usually you pay for Wi-Fi on board, but since it started, they gave it us for free. And as you came into the Radisson, your phone connect directly to the Wi-Fi. So there's no thing to say that you cannot really use the Wi-Fi. You can't call this person. You can't do this. There haven't been restriction like that. Only restriction that they said that you must keep your mask on, you must stay your distance apart. The usual thing that we are used to on board. So we should be used to that by now.
All right, so yeah, that was an interview that I conducted on Saturday morning with one of the Belizeans who was able to return home. It's one of those feelings where okay, let me also say this. It's not an interview that we've aired in this segment. That's reserved for the newscast. However, I was also able to speak with a woman whose husband was on board the vessel as well. And the thing about it, from her description, it was sort of like a bittersweet feeling. Happy knowing that her husband is back in Belize, but she won't be able to see him for another 14 days based on the quarantine.
Yeah.
When she saw him several months ago, when he was leaving, they did not have the slightest clue that they'd be stuck at sea, essentially, right? And so one could only imagine, you know, either getting that phone call or you communicating with your loved one and they say, you know what, the borders are closed and I'm going to be stuck out here for an indefinite period of time. One can only imagine that conversation, right? And so I was speaking with her casually before I got into an interview where she was explaining and describing her feelings, you know. She was like, you know what, the experience makes me realize how much, you know, I do care for the well-being of not only, in this case, my husband, but other persons on board the vessel based on the situation that we're facing on land. And so it was a unique perspective that she shared with me in terms of the arrival of this ship and its passengers.
Yeah, and of course we can't forget the context that this happened. In our response to the pandemic and in trying to mitigate the spread of COVID-19 in Belize, the borders were closed, and that included the return home of Belizeans, and so that was perhaps one of the most stringent measures that we've put in place. That's very atypical. You wouldn't normally block your own nationals from coming home, but we knew, or it was clear that there was a risk that was involved. And so now with Belizeans being able to come home, I understand, and I've seen a lot of the comments. I think people are very worried. We can't speak for all, and we are told, I think, from Foreign Affairs that there's somewhere around 200 people that want to come home. In the situation of the cruise ships, though, I think one of the interesting things that is worth noting is that, and that's in conversation with one passenger last week, she said that it was a regular part of their daily routine to get checked. So they had to report anyone who had any symptoms. If they felt the slightest bit ill, they had to be checked. But there is also daily body temperature checks to check for fever. And they've been pretty much isolated to their own rooms for the entire duration that they've been at sea. So I think that definitely, I think for people who've been worried, that's one of the areas that can kind of let us feel like they have been monitoring themselves along the way. The 2 weeks mandatory isolation. I know some cruise lines, and I don't know if all these passengers are being sponsored by their employers, because one of the challenges with the repatriation is that Belizeans will be asked to pay for their quarantine. And so it's anything from, I think, like $1,500 and up to be able to pay for your 2-week stay at a hotel, including meals. And it will be the mandatory, as we have been told before, which is, you know, you can't have any contact. You can't move out of the room itself.
In this case, they are being hosted by the Radisson. And as I mentioned earlier, there was a brief by the Ministry of Foreign Affairs and, of course, the Belize Defense Force. As I said, they are providing the security to ensure that these persons remain compliant with the rules of the quarantine.
And I'm sure people noted that they probably weren't tested as soon as they came off. Of course, the Director of Health Services has said that they won't be tested until they complete their 14-day quarantine. And if there is a positive case at the end of that 14 days, then they will go into 3 weeks of isolation. So instead of testing now, they're going to wait out the quarantine and test them before they're allowed to leave and go back to their respective homes.
So this is sort of a feel-good story if you look at it from a certain point of view. That you know, we're glad that they're back, and they seem to be all in one piece and happy to be able to be on mainland and return to their home country. Right. So you can expect to see that story a bit later on in the evening news, and there's also just to put this out there as well. On Friday evening, we reported on a double homicide done in Hopkins in the City River area. And so we'll be following up on that with the police department. I know that it was late on Friday evening when we had certain interviews and certain information, but from the police perspective, we should be able to follow up on that later today as well for the 6 o'clock newscast. So other than that, it was a fairly quiet weekend. Most Belizeans were out and about enjoying, the 3-day weekend.
And
right?
the freedom to be able to experience local tourism and go out to the seas, the rivers, resorts, and kind of just feel like
some sense of normalcy.
a breath of fresh air again.
Yeah.
But
so with that, Marlene, we conclude our Eye on the News for today.
all right, and with that, of course, we got to get moving into our show for today. And we're starting off with a conversation about the health sector in Belize and also how health pertains to our education system. We're going to have a conversation with the Dean of Faculty of Health Science from the University of Belize, Dr. Lisa Johnson, and there's a whole lot that we're going to be discussing in her conversation.
Yeah, and so in the second part of our show, we'll be having a conversation. It's called the BTEC Communication Series, and so we have our friends from the from Beltrade, the BTEC arm of Beltrade, that will be discussing what's up with that series, Marlene.
All right, and before we close off the show for today, parents, do remember we have our Kids Time sponsored by J&W Shopping Mart. And today, Dr. Binox is going to be teaching us what is a pandemic. So you can be guaranteed that he's going to entertain and educate the kids. So make sure you put them in front of the television at the close of the show. But before we get moving into our conversations that we have scheduled here for today, we do have a special guest joining us to make an announcement. At this time, let's see, did we lose her? No? There she is. All right, we have the principal of St. Catherine Academy joining us, Salome Tillett, and she has an announcement to make to her students this morning, one that we're very excited about. Good morning. Good morning. Hi.
Hi, morning.
All right, we are live, and I'm sure now the parents are rushing in front of the TV to find out what you want to announce.
Good morning, Marlenia. Good morning to the parents of SCA and actually to Belize. Good morning, Belize.
Good morning, good morning.
Yeah, so we understand that you wanted to inform your parents of something special that you guys have been cooking up there.
Yes, thank you for this opportunity. And parents, I will start with an apology. We have been almost incommunicado. But what we did was to select a team of parents from each class. Actually, we selected 2 parents from each class, and we asked them, help us to come up with ways that we can make this graduation special for you. And they submitted a proposal. We discussed this with our school board, and we were so fortunate that just at the point when we were deciding, okay, what else can we do? We got in touch with Channel 5, and we have agreed to have a virtual graduation.
Yes.
So SCA will be partnering with Channel 5 to do our first ever virtual graduation. That's exciting for us.
Yeah, it's the first one for us too.
It's exciting all around.
And the first one in Belize. Ms. Tillett, I think what's key here is that you know how important the graduation is as a rite of passage for your students. And I think the fear that, or the sadness that parents had in not being able to have that moment, this will be able to help some of them.
Yes. So, graduation is a culmination of 4 years of hard work. And for many girls, they start school waiting for that moment. They start planning, I will work hard because I want to be valedictorian, I want to graduate with honors, I want to achieve a certain award. So the work starts from even standard 6. They come in thinking about the end. And it is so unfortunate for the class of 2020, throughout the world really, that will not have the opportunity to do the traditional graduation. So this gives them an opportunity to still celebrate this milestone along with their parents. Actually, it opens up the opportunity because we can do so many other things. We're not limited by numbers.
Yeah.
You know, every year the graduation invitations are limited.
Yeah.
And this one has no limit because it
No
will be
rationing
like
of invitations
10 and 5.
here.
I have one question, and perhaps this would more be for either a student or a parent, but since we have you online, perhaps one of the only downsides would be not being able to wear your gown itself, or what happens there?
Oh no, we have a plan for that.
Okay.
We have a plan for that. Our students will receive a graduation package, which will include their cap, tassel, gown, diploma holder. They get to take it home. They will have it for about a week to do pictures, and each student can do a 10-second video of themselves saying this is so and so, and saying a very short memorable quote, the type you would put in the yearbook. So the student sends in this quote to Channel 5.
That's it.
And we will pull it together. So as a part of the virtual graduation, we will be calling the student's name, and instead of walking across the stage, they get their 10-second video to pop up on the screen.
10 seconds of
get
fame.
their family to share in that.
Oh,
Nice,
I get goosebumps
nice.
just thinking about it. Graduations are so special. And, I think that this is a unique time, but it also presents a unique opportunity to offer something special to the parents and students there. You guys definitely have been coming up with some great ideas. And when is the graduation going to be so we can all schedule to watch?
We are planning for Saturday, June the 13th at 9 a.m. And I must say thank you so much to Channel 5 for the partnership. It opened the doors with the help of Channel 5. Now, I have parents who are excited that the family in Trinidad can be watching the graduation. They wouldn't have been able to make it, but they can still see. And our valedictorian still gets to shine, and we still get to have a message to the graduates by a guest speaker. So many good things, and it's possible because of the wonderful partnership with Channel 5. So we're really excited about it.
That's
Perfect.
right.
Perfect.
And we are so excited. We wanted to make sure we made this announcement because I'm sure parents have been asking. And we are all looking forward to bringing a moment of upliftment in all that we have been going through.
Yes.
Thanks so much, Ms. Salome. And of
Yes.
course, we'll be seeing
Thank
you
you.
and your girls and your school shine on June 13th at 9 a.m.
Thank you.
All right. Have a good day.
And you too. Thank
All right.
you. Bye-bye.
That makes me happy.
Yeah, it's warm.
Yeah,
It's a
it
warm
gives you a pretty good feeling. And I should say, actually, that this television, we have our usual programming that we do. It does involve audiences. So we had to shift our strategy here.
Yeah.
And so this was clearly an opportunity to offer great programming to people and also be able to feature just the young, brilliant minds in our country. We'll be having 3 graduations online. St. Catherine Academy is going to be the first. We're going to be having a school from the northern region, one from the southern region, and then we're going to have the Belize City one as the first one on June 13th. So you can look forward to that as we move into the
Graduation
end of
season.
the school year, graduation season. And it's going to be, I want to hear them. You don't always get to hear valedictory speeches. And I think that it's always really great to hear just how our young people are thinking. Now they get to broadcast it to Belize and beyond.
Yeah.
All right, so there we go. Feel good moment. And we're going to keep the conversation going. So we'll take a break, and when we come back, we're going to be talking to Dr. Lisa Johnson, the Dean of the Faculty of Health Science from the University of Belize. So please stay tuned.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you.
Germs make people sick. And that's why it's very important to wash hands.
Hooray!
It's important to wash your hands, so follow these steps to do it right.
1,
Turn on the water and wet your hands.
2,
Use soap to lather your hands and scrub.
3,
Rinse your hands completely.
4,
Now that your hands are clean, use a paper towel to touch the handle and turn off the water.
5.
Dry your hands with a paper towel.
Hooray!
Follow these steps every time and you'll keep germs away. So remember, the best way to fight germs is wash hands.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. We are about to commence our first conversation for the morning. Marlene, it's a two-part segment. And joining us in the virtual space is Dr. Lisa Johnson. Good morning, Doc.
Good morning to you both.
She is a general and trauma surgeon as well as the Dean of Faculty of Health Sciences at the University of Belize. Our conversation with her this morning is going to be around the development of the health sector in Belize in the context of COVID-19. Good morning once again, Dr. Johnson.
Good morning, and thank you for having me.
Where do you want us to begin from? Because when we look at the health sector, we're looking at a very robust and important area of the overall landscape that ensures that Belizeans and their well-being remains either safe or well put together. Where do you want us to begin from?
Well, when you look at the health sector, I'm a structure person, so you must look at the structure first.
Yeah.
Health, and some would say wellness as well, has two main fronts of attack as it relates to public health, the health of the individual within a society. So there are those areas and those specialties that deal with primary health care, the public health, health education, and the health of a society on a whole. So that would include your public health specialist, your public health nurse, your public health inspector, your vector control, those who maintain potable water, those professions, as well as the epidemiologists, those who track disease, and of course those who educate, those who break things down so that everyone can understand what is in their best interest, what is to happen. So that in itself is one particular structure. The other structure then is hospital medicine, which is a different animal, and the levels of hospital medicine: secondary care, tertiary care, and quaternary care. Now, if you want to say that you would want to be robust in your public health prevention and education, so that there is less strain on the secondary, tertiary, and quaternary. There will always be diseases that we have to deal with. But if you keep your society healthy, then the strain on the other part it will diminish, of course. But it doesn't mean you don't have to have them, and it doesn't mean that you do not ensure that they are of the highest standard and quality.
Yeah.
So in terms of development, both arms need to be developed in tandem with each other, but the underlying principles of both differ to some extent.
So when you look at Belize's response to COVID-19, and I really appreciate your differentiation between when we talk about healthcare, just from public health right up to some of the most specialized care that we may or may not be able to offer. But our COVID-19 response, I think what was most visible to the public was looking at the public health aspect. But it was also very crucial that kind of behind the scenes, we're strengthening or reinforcing the other aspects of healthcare. How do you think we fared off?
We have done reasonably well. We have, I think, and I would hope, learned from any early missteps that may have occurred. I think that we started off on the footing that people would be responsible and follow strong suggestions, and that the public and those who came into contact would act appropriately. And I think, unfortunately, human nature just does not take us to that realm. And so I think it became clear that people have to be managed in a certain way. Once they've been identified as potential, as at risk or exposed, then the rules need to kick in and the rules need to be enforced. And I think that may have been a bit of a learning curve. But I would hope now that we are repatriating citizens that those rules, in most situations in this country, the rules exist, just don't enforce them. So I'm hoping that is the major difference that occurs now.
Yeah.
When the hospital system was accessed, certainly there are things, if one takes into consideration what relatives have put out and what others have put out, one would want to hope that whatever issues arose there have been corrected.
Yeah.
But I will say this, the pandemic is not this place where your best can come out if you had not put your best in from the start. So you've got to be at a certain standard and you've got to be following certain principles, because when the pandemic comes in, that it shows up all the things that ought to have been addressed that will not be addressed. And the longer that the pandemic sits on as a specter over the entire world, the more likely it is that more gaps will come to the fore.
That's a sharp point that you've raised there in terms of, if we look in the Belizean context, for instance, one could argue that our healthcare system, in a manner of speaking, has not really been tested based on the fact that we were able to mitigate and keep our outbreak down to only 18 persons. How would you respond to that?
That is, I think every COVID patient is a test.
Okay.
So it has not been overwhelmed, which is the whole point of the public health structure and initiative, is to not have your system tested. But in a situation like this, every patient that accesses the system, whether it is the public health system and the epidemiologists and the disease trackers, or it's the hospital system and the doctors and nurses on the front line, every time there's contact, there is a test.
Yeah.
The thing is one must understand that it's a test, and one must seek to learn from the test.
You know, I think one of the things that we saw globally was, and I think it perpetuated quite a bit of fear in people across the globe, when we saw what are considered some of the world's best healthcare systems just struggle in being able to offer adequate care to COVID-19 patients. You know, we see in the United States, which is where we get most of our news from, but we were also seeing stories coming out of Europe and other parts of the world. We didn't necessarily have that test, and I still go back to what we said before. The public health efforts was kind of like the first barrier to prevent us from getting to that space. But you said something so important, and I think it's that the pandemic won't just allow us to kind of be up to par. We won't be able to just rapidly equip and train people to offer that type of intense care that will be necessary. So in a sense, what has happened is it only highlighted a challenge that we have always had, which is that our tertiary care, or only public health tertiary care institution has just not been able to improve over the years, and in fact has been lacking in many areas.
Well, my time there as Director of Medical Services, we spent a great deal of time training. Training in quantity and in quality. Levels of training that we had not, that I don't know if the transition had seen before. And there was also a great push to get doctors and nurses, whoever could get out to do further training. Dr. Koya and myself concentrated on trying to get people out to do further studies. The building of capacity is very important. The capacity not only of the infrastructure and equipment, but also of the brain power and the brain trust, so to speak. And so the time that I spent there was about improving standards. It was about training and training and training and training.
And from your knowledge, having worked in the institution, had we had the overwhelming number of cases, and at this point, I think we often think that the big numbers would overwhelm us, but it would take very little to be able to overwhelm our healthcare system based on our capacity.
Yes.
And just from what you know, would we have been, how do you think we would have fared off?
I will tell you that the doctors and nurses would have done everything that they could, but they would have been limited by the amount of beds, the physical beds that you have that are present, and the number of other equipment that would be needed to maintain patients. You see, what people don't necessarily know, for example, is that every hospital worth their salt, first of all, will have a mass casualty policy. A detailed document that instructs the administration, the doctors and nurses in the front line on how to deal with a surge, overwhelming capacity. But one has to understand that the pandemic and how it has fared out in other countries is a mass casualty times a million. So when we have a mass casualty, for example, I can recall the influx of 50, maybe 20 patients, there are lots of things that have to happen that the hospital has to do and is instructed to do when we call a mass casualty. Everyone has all the relevant specialists have to come in. If there are additional nurses that can be moved to the accident and emergency, that is done. Other things slow down. All elective and non-emergent services have to stop to allow for the surge to be dealt with. But what this pandemic has shown us is that it is an overwhelming, continuous flow of very ill patients. So there's actually no health system designed or in the world that has the capacity to deal with that if public health measures and the safety measures aren't put in place. None in the world.
So what would be the primary takeaway here for our experience in terms of trying to now develop a system that works? I know that perhaps between now and when a second wave, if there's any, comes around, what can we put in place to address that in the short term? And what can we put in place to address the overall state of the health system going forward?
Well, the first thing, because at the tail end of it is the search. So the education of people and for people to have the understanding that if we are passive participants in maintaining our health and wellness, then don't be surprised if the system cannot take the load. If you don't look after yourself and you don't participate in the community and in the society initiatives to protect itself, what is at the end, no one can prepare for in that sense. Having the things of having the PPEs, making sure that people remain ready to deal with it, ensuring that what we can do well. That should be that's an ongoing situation with adding the PPEs to the situation to the package that should already exist, and so it's ensuring that package remains ready and aware. But it will take the entire country, the entire population to understand the role they play.
So in other words, and what I hear from you, and I think it's critical to say, we don't want to get to the point where you're going to test the mettle of the healthcare system in terms of very advanced care. We need to do our part to not allow that to happen. But even so, in the worst case scenario, I'd imagine, not the worst case scenario, in this time between what we keep on hearing, which is there is going to be a second wave, it is highly probable that we will have a second wave of patients. It's important to kind of get your house in order. You had that first test.
Yes.
We had 3 hospitalizations here in Belize City. We had 1 in Corozal. My numbers may be off, but that's what I can recall at this point. We had 2 fatalities. I really want to bring out a point that one physician pointed out to me, that in fact in the hospitalized cases, we had no frontline workers exposed. Because often when we criticize the healthcare system, I think people who work there feel that they're being criticized, but clearly they did what they were supposed to do, and none of our frontline workers became infected with COVID-19.
Yes. They were exposed. But there was no documented transmission to healthcare workers, so which is excellent under the circumstances, and lucky in some respects.
Absolutely. And I use that point to say, because you said it before, you said the doctors and the nurses in any one of our healthcare institutions are going to do their absolute best with whatever they have to offer the best care that they can. And so it shows that even though we don't have a regular custom of using PPEs or dealing with this level of infectious disease, that they still did the best that they could. And even though they were exposed, we didn't document any infection. But it is a time where perhaps we can look back at even the 3-4 hospitalizations that took place and assess where we're going to need to strengthen and where we'll need to enhance protocols that were quickly drawn up, because it is a pandemic that for the most part caught us off guard, and get everything in order for what lies in the future. What do you think?
Yes, we've entered. Sorry.
No, go ahead.
Yes, we have been in a lull. Is it the eye of the storm? And yes, this is an opportunity. I would suggest to my colleagues in those hospitals that they tease and dissect all their interactions with COVID-19 patients
Yeah.
to understand where better can be done. I am not saying that the best was not done, but we must always seek. Modern medicine is about always seeking to understand what has happened, whether or not it went well.
Yeah.
Those experiences should be dissected so that for the hospital practitioners, doctors and nurses and allied health professionals, so that you understand what can be done better, what can be done more efficiently, what can be done more effectively. That would be my advice to them.
In essence, we're saying that there's always room for improvement, correct?
Always, always.
You know, and us as the non-medical public, and I think because of the reports we were seeing in other parts of the world, we were very focused on how many ventilators and how many PPEs were accessible. But what are some of the other tools, training, or necessary equipment that, from your medical perspective, you think that we need to be paying keen attention to assess our level of preparedness?
Well, it's very important that each institution understands and has laid out clearly for its staff how potential patients should be handled. What is the flow of the patient within their institution once the patient makes contact. So if the patient comes in and is a suspected COVID case, where do they go? What should the staff do to properly manage this patient? And it can't be that the staff are not made aware and have access to the basics, which would be, of course, the PPE. But each institution has to have it clear and train into their staff what are the steps that are to be taken when their institution comes in contact with a patient. And that can be practiced. You can do simulations, you can do further training, because as we speak, there's more and more information coming out about the disease.
Yeah.
Much more about the wide variety of pathology that can occur. So that information needs to be passed on to our frontline practitioners in a manner that they can absorb, and so that it continues to maintain and build awareness. Yeah. So those are some of the things that need to continue to happen. Yeah. It's a matter of being honest with yourself as administrators and people who manage frontline health professionals. Yeah. That there are always activities that are geared towards preparing their staff.
Yeah, yeah. All right, well, what we're going to do right now, Dr. Johnson, is take a very quick break. There's quite a bit more that we want to discuss with you, but we will be back in just a few and continue that conversation.
Our full-tech family remains
pandemic continues to affect the lives of all Belizeans, Channel 5 is keeping you informed of all the latest developments. For an insightful look at the week's events across the country, tune in to Uncovering COVID-19, a Channel 5 special every Friday at 8 p.m. Join host William Neal and his guest panelists as they provide in-depth analysis on the impact that COVID-19 is having on all of us from a health, economic, and legal point of view. Don't miss this informative and significant television program, Uncovering the COVID-19 Pandemic, every Friday night at 8, only on Channel 5.
And we're back, and we are continuing our conversation with Dr. Lisa Johnson, who is a general and trauma surgeon and also the Dean of the Faculty of Health Science at the University of Belize. Dr. Johnson, we just started to scratch the surface on or look at the healthcare system and just the things that we now see having faced or being in the midst of a pandemic. Let me bring your professional capacity into this at this moment. In fact, you were just named the Dean of the faculty, the newly formed Faculty of Health Science. I think it was last year, right? Just a few months
January.
ago. It was okay.
January
It feels like a year since January. But nonetheless, it was a very critical role that was being established in our national university. And I know you had a lot of plans in place. Tell me now what happens since even the education system has had to quickly reform.
Well, over a year ago, the university and its board of trustees made two decisions. One, they wanted to open a medical school, and two, when they looked at their organizational structure, they wanted it to be a part of what they had already established in the Faculty of Nursing, Social Work, and Allied Health. And so they were going to put all the healthcare professions in one faculty, each their individual programs, and so created the Faculty of Health Sciences. And then went about doing some of the things that they needed to do. They formed a partnership with UNAD and in Nicaragua, and then they sought to find dean. I was recruited, and so we had been in the preparation stages to get the medical going, but there are certain principles that needed to be followed and needed to be strengthened. And given that we already have a very long history of training nurses, pharmacists, medical laboratory professionals, it was very important, in my view, that those programs get the absolute opportunity to strengthen themselves, because when the medical school starts, it will be pulling from a healthy structure.
Yeah.
So what the pandemic has done, it has caused us to move a significant amount of theoretical content into the online space. And I would have been one of the last people I would have expected to now understand understand now clearly that this space can be very useful to us.
Yeah. So, of course, the migration to online learning is the first change that has to be made. But given the context, is the university looking at perhaps being playing a part in being able to offer maybe continued professional development in perhaps some courses that will be relevant to the addressing the pandemic, whether it's looking at emergency care or understanding more about COVID. You know, there's so many courses online now to be able to offer this.
Well, you're talking about the training of specialized training,
Yes.
more specialized training,
Yes.
and we are not there yet. When you look at continued training for healthcare professionals, it's not everyone and anyone that is equipped to do that. We learned a lot of lessons. For example, when you were doing it at Kushner, it required partnerships with institutions of some heft. And so for us right now, what we are trying to do at University of Leeds is to make sure that the programs that give you those certified professionals are at their best. That is the commitment of the faculty of health science. That we continue to produce nurses, pharmacists, medical lab professionals, and social workers of the highest quality with the appropriate package of knowledge and skill. When it comes to the further education of these professionals, then those are add-ons. So, for example, the faculty has run on an ad hoc basis nurse anesthetist program, midwifery programs, and at this time, a degree in public health nursing. It's a program that's currently being worked on by senior people in the Department of Nursing. So from that point of view, the question becomes how do we pivot for COVID? I think more than ever, COVID shows us that we need to be training our own doctors. We will always be in the situation of benefiting from the kindnesses of other countries. And if travel gets cut off in more serious ways than it already has, then the countries, and I'm talking specifically Cuba, who has been holding our hands for 30 years, we have to understand and go back to the old principle. If somebody's helping you, then you need to be preparing to not need that help.
Yeah.
Well, then the question.
Or, you know, I don't see things any other way. We need to be getting ourselves into the situation where the help evolves.
Well, the question then becomes, what have we really been doing? If you're saying that for the past 30 or so years, Cuba has been by our side, what essentially have we been doing to be able to stand on our own 2 feet? When you look at the situation as it is, we are grateful that Cuba was able to immediately dispatch its medical brigade to Belize, but you know, as a country, were this not to have been available to us, what would we have been doing to be able to lead the charge on our own becomes the question, correct?
Absolutely. The alliance and the relationship between the health sectors of Belize and Cuba goes back to the late 80s. I think the first meeting that took place, my mother was a part of it because she was the principal nursing officer of Belize at the time. And so, yes, this thing runs in my blood. And so, you know, we continue to rely on a country that continues to be most helpful to us. And what we need to do is to figure out, okay, We continue to get nurses, we continue to get specialists. So we need to train more nurses and keep them here. So, UB will look at the point of how do we make sure our program meets regional accreditation, and then ramping up that training so that we are putting out more nurses. But then you have to make sure the program is at the point where you want it to be, or headed in the direction that you want it to head. And then the launch of a medical school will become part of the getting itself ready to evolve in its relationship with Cuba as it relates to the health sector.
You said something, and I wanted to pick up on it, because I think you know very well, having worked outside of Belize, that oftentimes people do go and get specialized training, whether it's as a physician or even as a nurse. And you have quite a number of students right here who graduate from the nursing school, but simply put, the opportunities outside of the country are far more alluring, or the conditions that they'd be asked to work in locally leave a lot to be desired. And so even if we have a medical school or a strengthened nursing school, will we be able to keep the people that we've built the capacity in?
Well, that is up to us as a country. It is very much, do the people of this country want quality health care? And how do you think you're going to get it? And how do you think you will keep your trained people or encourage your trained people to come home? It is the people here, living here every single day, going about their business. They're the ones who are going to determine how this thing comes out. Mm-hmm. Because if you have a system and a structure that does not encourage people to stay, that does not recognize the work that they are doing, that has decisions being made by unqualified, unenlightened people, that then affect how they do their job. One of the things that I maintain, that I find it difficult to listen to someone who has not had to be responsible for whether a person lives or dies. Mm-hmm. So your input into how I do things has a certain level. And if that's how we want, as a country, we want decisions to be made, then you get the results that you ask for. So it is about what you tolerate.
Mm-hmm. That is very interesting, and I think, I think the core of the matter as well is what this COVID-19 pandemic has done is just shown us where or lack of investment in the healthcare system has actually been to our detriment. Or monies are funneled in other sectors that are seen to be more lucrative, but it was left to be lagged. The health system was left to lag behind so far that we have a lot of catch up to do. And the complaints, I think, are interesting. We hear from the BMDA, the National Association of the Nurses Association of Belize, and the KHMH Workers Union. And a lot of it was very similar. It was about resources. It was about being able to feel that they had what they needed to work with. And what you said just now about whether or not we'll be able to retain people who are trained, it goes right back to the same as in investing in the healthcare system. It's also recognizing what you're willing to offer people to be able to stay in the system. Would you agree?
Yes, and it's not always about money.
No.
In fact, most of the time, it is not about money. It is about respect for the work, respect for the knowledge, respect for the certifications and the training, and understanding that that certain decisions need to be made by those who are trained to make them, and that there is great value in building capacity. Yeah. Sometimes, in countries like ours, training is doled out as a particularly foreign training, as some sort of gift. It's not a gift; it's a necessity, and right. The best people should offer the best opportunity. The best trained people, the best working people should be offered the opportunity for improvement so that they can improve home.
Part of that too is the fact that we often view training as a one-off thing. We don't insist on continuous professional development, if I may. Whereas you continue to train to make sure that you're on top of all the changes within that particular field or sector.
Yes, and medicine is so vast. I qualified in 1994, and I'm happy now that I'm not a general practitioner, that I'm a general and trauma surgeon, because general practitioner has to have the length and breadth of medicine just continues to expand.
Yeah.
And so the length and breadth of general surgery and trauma surgery is expanding, and so I can concentrate on those two particular areas. But for the person who has to have a multi-dimensional practice, if you're practicing how you should, you're supposed to be reading every day, practically.
You should have your nose in a book most of the time. I mean, and it's given what they can handle too. Because if you look at the workload, especially at the primary care level, sometimes there's a lot of people to see and a lot of paperwork to fill out. The time for the books may not exist either.
Yeah.
But that's why it has to be built into the work.
Yeah.
The work must allow for, because in situations you're in a clinic, you have to get through a number of patients, but your employment should also include the space and the time to improve yourself.
And that's what you mean when you say being able to acknowledge the needs of people within the system. And I'm glad you said that, because I think automatically people assume that when we say resources, we think money. And that's not to say that it has to be an offer that will allow people to stay here. We see it all the time with our nurses. And I've talked to students coming out of UB whose exit plan is basically, when I graduate, I have these 3 countries I can possibly move and work to. Those are the options they have on their table. But let me bring
and it will get further by the countries that have lost healthcare workers during this pandemic.
Yeah.
They're going to be combing the world for seasoned professionals, and ours will be snapped up.
And let me bring it back to the current situation at this time, because I don't want us to close without kind of getting just your perspective on this particular point. We hear very often the health experts internationally talk about how COVID-19 is here to stay. We've been living the past 2 months in just a completely different world. And when you hear that this disease, this perpetrator of uprooting everything we know is not going to go away, just from a science perspective, how do you explain that to people? If your loved one said, what do you mean we're going to live like this forever? How do you explain that?
No, we won't live like this forever. Humanity will adjust.
Yeah.
So to find that out, to understand that, all you have to do is look at history. Mm-hmm. You look at the Black Death and the bubonic plague. Killed millions of people. Documented first appeared in the 1300s. And went right up until the early 1900s. And what was the best thing that happened is that it did occur, it showed its face again in the late 1800s and early 1900s when medicine and science were then able to understand the causative agent and then act to prevent. So we have to understand that if there's a vaccine available next year, that will be, as Bill Gates says, the fastest time in human history when such a disease, such an agent was identified and a vaccine developed in such a short period of time.
You're saying 1 year is short?
Yes, it is.
In this case, necessity is the mother of invention. So
necessity is the mother of invention, and so everybody who can work on a vaccine is working on a COVID-19 vaccine. Yeah. What shape that vaccine will take? Is it going to be the type of vaccine that gives long-term protection, or is it going to be a vaccine that you have to take every year or every 6 months? We don't know. We won't know until the data comes in. But humanity will adjust. Yes, we may lose, people will start to worry about the time that we are losing, but you have to understand what we are fighting as a species. It's an attack on an entire species, us as human beings. And so I'm trying to say to people, as bad as it has been, it can be worse. And we will have to find ways to get our economies to work. We won't be able to sit on our hands for too much longer. Yeah. The key thing will be to approach it scientifically and to have your best minds working on possible solutions. Right. And we are going to have to follow rules.
I was going to say, and we have to keep up our part of the work as well.
Yes. Yes.
And that's where I find that, public health is hard in itself. It's behavior change. We're not so good at changing our own behavior when we want. Things like washing your hands and social distancing and cleaning, shared spaces, disinfecting. These are all things that are required of us and that we do have to maintain. And the masks as well if you're going to be around people.
The same respect when we go to other countries, same respect that we show for their laws and structures, we need to show for our laws and structures.
All right. Any closing thoughts?
Just that we will all have to be and continue to be open-minded in that we may be flooded with theories, suggestions, and so on. We have to be open-minded, yet we also have to make sure that we don't hang on to the wrong information.
All right, Dr. Johnson, thank you so much for joining us for this conversation this morning.
You're most welcome.
All right, do take care and stay safe.
You too.
All right, we're going to go ahead now and take a break. And when we come back, we're going to be talking about some of the training opportunities available at BTEC. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
In these
And we're moving into our final conversation for today, where we're exploring the training opportunities available right here in Belize. And of course, that means online, courtesy of BTEC. We have with us joined in this conversation this morning Marcelli Richards, who's the Training and Recruitment Officer at BTEC. And we have two of the training facilitators, Chantel Hill and Tremet Perriott. Good morning.
Morning.
Good morning, guys.
Okay.
Hey, Sunny.
Morning, my brother. Morning.
You good?
Yes, man.
All right. So let's start with Marcelli. Marcelli, tell us, the initiation of this online training series and what components you decided would be most necessary right now.
Okay, great. Well, of course, this is an initiative that we are participating in. Beltrade usually does this every year. For this month, it's our National Competitiveness Month. And throughout the units, there are 4 units within Beltrade. And with our unit, we are intending to do our digital communication series, which most people are being launched within Facebook. The idea of the digital communication series is just to reach out to our stakeholders and partners, and most important for us, our participants that has done a training with us. It's very important for us to identify the needs of individuals, keeping yourselves upskilled in regards to employment. And again, as I talk to each of our participants, I'd like to share that this too shall pass. It seems like forever. However, it is important to keep yourself upskilled in that whole mindset of being positive, and afterwards you want to be that top employee to be chosen to get back within the work environment. We just feel that digital communication is very important because the core of connecting with anybody, be it work or personal, it starts with that clean communication.
So you're right.
That's right. So when you say digital communication, what does that mean?
Well, I mean, if you're not noticing, like everybody else, we're kind of moving into an online setting, right?
Yeah.
So it's not so much a personal one-on-one basis. And I think it's just important for individuals to be aware when you're talking about communicating, there's a platform that you have to keep professional to a certain extent, especially when you're getting through hard times such as these. When I talk about digital communication, again, it's just because majority of what we're doing is going to be moving more into an online setting. And it's very important to bear in mind that all the communication techniques still coincides with this.
Yeah. So, Trevor, let's talk about your contribution to the training. You offered a training session on self-reflection. Tell us about that.
Well, the self-reflection, I mean, for the last couple of months, we have been cooped up, so to speak, and many people struggle with what they're going through, and I believe it was a good time, especially for me, hopefully for other people, to take the time to study themselves, take a look at how their lives will progress after this particular time, how it has progressed through the years that they've been going through, what things they'd like to improve on themselves, what kind of mindsets they'd like to develop, what kind of forward motion they would like to have as things get up. And so when you're talking about self-reflection, all of this is in that, and it's a very difficult discussion you have to have to yourself. You have to say, self, will you improve? And then you have to look at yourself and say, yes, self, I will improve.
Wait, I thought you were waiting for the answer from self just now. I was giving.
Oh, you talk to yourself, look yourself in the mirror and say, self, we're going to have this discussion.
Yeah.
And I think that through this digital series, it is competitive week, so we want to win, and I don't know what we're going to win, but we're going to beat the other. Right.
Yeah.
You get the idea. But we want to impart knowledge, hopefully, to help people build themselves, not just skills-wise, but personally as well. And I think that Marcelli has done an excellent job of
Here's an interesting juxtaposition.
Here, no?
Here's an interesting juxtaposition, if I may, right? How do you deal with trying to motivate others to be the best professional they can be, either within the digital realm in person at work or what have you, when you're looking at persons who by and large at this point are unemployed and they're trying to figure out how do I jump back into the workforce? What would I need to be able to make me more competitive? What gives me the edge? How do you look at these two things?
That's a question that we've been trying to answer. It is difficult. I don't think there's any specific answer to that. I mean, it's a very personal journey that each person has to take. What we're trying to do is give people options to help with the process. The things that we do won't be for everyone, and it might be for a lot of people. Our hope is that we capture more people than less in providing an opportunity, skills-wise, and an opportunity emotional-wise to help grow. Some people take whatever information we have and use it in their everyday lives. I mean, but we have to practice it first before we can show it and or teach it. And so for me to look at someone who doesn't have a job and say, hey, remain positive, yeah. No. You know, it's not necessarily a good front. However, we can as a unit provide techniques and different things that they might want to put in their lives, and hopefully it helps them. Yeah, coping mechanisms, yeah.
And you know, I appreciate you saying that, Tremit, because you're right. It takes more than a positive attitude. It does take opportunity as well. And what this does is perhaps get you in the right frame of mind to seek out opportunities. And I wanted to get into that because, you know, the BTEC is essentially a training center to help to make people more employable. And where right now jobs are a lot of people have lost their jobs, they can be looking online. And this is kind of like developing the skill sets to do online work. What is the objective that you have? Would it be for people who are unemployed to find new jobs, or is it for people who are making this migration to an online realm to be better at it?
In the planning phase of all of this, we started thinking about what people in a whole would want, coming up with the topics for the digital communication series.
Yeah.
And a lot of these topics are full-fledged capacity building workshops that we normally would take an entire day to do. So we went through and we selected what we felt were the core objectives of our workshops. And it would benefit people who are employed and people who are seeking employment. Our upcoming videos are more geared towards time or personal management. So it would help to equip people with skills who are working so that they're more efficient and effective. And it would also help in your personal lives. It is the same with our communication 101 that we will go live with this Friday, actually, May 29th. It is verbal, nonverbal communication. It is communication styles and personalities that we will be covering. It is addressing how to build your social awareness when you are communicating. So a lot of these workshops tend to be enriching for people who are working, but it's also developing yourselves on a more personal level also.
Yeah. And how about adapting to this new online communication style? There's a lot to learn here.
Yeah.
Yeah. Trust me, as trainers, we are learning ourselves every day. And it's a bit exciting because you learn something and you can't wait to share it with others so they can be just as awesome.
Yeah. I think as long as the internet stays up and people have access to devices, we should be able to communicate, hopefully.
Yeah.
How we communicate, that's another story.
How we communicate effectively, and I think this is a great example here. We have our own learning curve, but you know, things like time delay, you know, you have to adjust to. Also, not having someone in front of you while you're communicating. We've done live training sessions with you guys on the show. Body language is very helpful in how you interpret how someone's communicating. And you don't get that in a digital realm. In fact, sometimes some people won't even show their face.
Exactly.
That is true.
Yeah.
It's the communication all compacted into one. And just as you mentioned, Marlene, when you're doing a digital communication or online session, it's something a little bit more intimate in a sense. If you want to think about it in that sense, you're not there with the person physically. However, when you are in the face of a camera, then you want to make sure you're on top of your game.
Yeah. For some people, it's a bit nerve-wracking to be put on the spot in front of a camera. No? It takes away. I'm telling you, it does take away from our presentation to an extent, because we at BTEC we're not just read off.
We're people oriented.
We're very active. A lot of the stuff that we do, sometimes we have workshops going on downstairs that we're doing, and people up here in the conference room having meetings, they have to say, "Oh, hey, you guys are making too much noise." But people are actively engaged, and I think we pride ourselves on providing quality trainings that keep people engaged and informed. Huh?
Yeah. So Chantel, tell us about your training.
Okay, for the live session that's coming up, we wanted to show people the top 10 soft skills, which is the session that I did. The top 10 soft skills that were admirable in employees, basically what employers are looking for. And we want to take those top 10 soft skills and move it or tune it more with our personal management sessions, which are coming up this week. And if you've been following our communication series, then Friday, it all comes together in our live session. Our live session ties together the mindfulness and the positive attitude that Marceli was doing. It ties together what Tremont was doing. It ties together everything else. When we talk about how to make us better communicators, like you said, we're moving towards a digital world. And even us as trainers, we're used to being in a large group with people in front of us. And it takes, a lot of people don't even realize it takes more tact and more energy when you're moving this online. So it is us having to be your utmost best when we're out there. And it is going to be a true test of it next month, actually, as we're launching for the first time our online office administrative.
Administrative assistant.
So
this is normally an in-person training that you're now shifting into an online format. Yeah.
So that was going to be the true test of how well it is received. This is going to be our first online training. We've cut it down to a month. We're asking people to go ahead on their page, fill in our intake form. You will need to have access to a stable internet and some sort of digital device. And we will want to see your faces, so you're going to have to be brave enough to put on the camera.
Stuff, you know. It's an interesting stretch course, and I think that I'm sure that it will be the future for us. This administrative assistant training, you know. We're doing it instead of the full day, because it used to encompass a full day. We now stretch it to 90 minutes for the day, and between 10 to 11:30. It's free of cost. You just have to register. I mean, this week, I think 25th and 28th is our pre-registering, pre-testing, right? Pre-testing, and there's a registration form at the bottom of the BTEC Bell Trade Facebook page site. If there is anyone who wants to contact us about more information, you know, you can contact us via WhatsApp or phone numbers, you know, 501-613-0150, which I'll give you again because we're all about branding, you know. Click here. Right.
But
and it'll be via Zoom and
the critical point here is that it's free. And I think
it's free. And in this day and age, I mean, nothing is really free, but I think this is a quality opportunity for people, even if working or non-working, to do it.
And it's two things. I mean, if you're not working and maybe you worked in a completely different field, this is one way to develop a new skill set. Right. And even if you are working and you want to move up, this is something you can add to your resume to kind of give you better opportunities as well.
Right.
That is the whole idea, Marlene, hitting the nail on the head.
Right on the head.
Again, for us, we just fully believe keeping yourself in that mindset, keeping yourself conditioned is more so important. We are posting that the training is free. However,
We have other
we are
trainings.
asking for 90 minutes of your time, but that is within the comforts of your home. So we're expecting to see a great turnout.
Yeah, excellent. And this will be the test, I guess, of other online training that you may be able to offer.
Absolutely, this is just the start. Once we find out this runs, smoothly or not necessarily smoothly, we're anticipating learning a lot of new things on the way moving forward as well. However, it's a challenge that the team and I were more than up to taking on, so we're looking forward to it.
Yeah.
And if any company, any business, any people want to train their staff, please feel free to call. That one might not necessarily be free, but it's still within a reasonable price range to get staff. I mean, we have to try and keep this place afloat for the greater Belize, no?
Of course, and I mean it's free for people to be able to access it, but it does take resources to put it all together. And I just wanted to ask, as you continue your digital communication series, what are some of the other areas that are going to be covered? I thought it was interesting that you did top 10 soft skills, Chantel, because I'm sure adaptability or flexibility is on that list, and boy, aren't we learning how important that is.
Yes, it is very, very essential. And one of the things I stressed at the end of my video, and it's something that we constantly stress here as a team, one person may not possess all top 10 soft skills, but it is something to work on that you constantly develop. And that is what it is. It is self-enhancement. One person won't be able to do all of those things, but it's about choosing which ones fit into you, and you can't pretend to be somebody who's flexible, because when you're put to the test, it will show that you're not. And even when we help people develop their resumes here, that is something that we help them try to find. What are some things that are strengths of yours? What are some things that you're good at?
Yeah.
And don't put it on there if you know you're not. It's about constantly working. If you know you're not a punctual person, please don't write that you're very punctual, but go ahead and see how you can improve on being this type of person.
Yeah, and it's key. I mean, I really like when we talk about soft skills, because that's a lot of what we're relying on right now. We're relying on our innovators to help us innovate and change. We're relying on adapters to kind of help us figure out the way forward. We're relying on people with really strong work ethics and all these other soft skills that are oftentimes not taken for granted, no?
Exactly. And whenever we meet with partners or we meet with shareholders, one of the things that they keep stressing to us is it is great if we find somebody who is qualified to do this, but even more so, we're open to finding somebody with great soft skills, with a great attitude, who is very coachable and willing to learn. We're willing to teach people how to do what it is that we need, but we can't teach people to have great soft skills. We can't teach you to have a good attitude. We can't teach you to be respectful. We can't enforce these values into you as a person, but we can teach you how to do work on a computer. We could teach you how to do the technical aspects of a job, but we can't teach those aspects.
And it's fascinating, because I think if you look at the global market, the emphasis on soft skills is really kind of overtaking the technical capacity.
It's 80-20 or something like that.
80% soft skills, 20% technical.
80% soft skills. All right, so that means we have to go and log on to your series to kind of see what we can learn in that meantime.
Absolutely. All right.
So how do you...
Make sure to call either the phone number or WhatsApp 501-613-0150.
Tremit, let's test your adaptability skills here, right? So since you want us to remember this number, one of the best ways to remember something is to hear it in a song. So you want to sing that number?
So just put the flashing lights up here. Click. Subscribe at BTEC at BelizeInvest.org.bz. That's the email if you want to send it if you don't remember the number.
Yeah.
BTEC, BTEC at BelizeInvest, one word, .org.bz. Please, everyone, just give us a drop.
And
We're
the
here to
easiest
help.
way is to find you on Facebook. That's what a lot of people do.
Easiest way, just, look for this face, kind of, well, not the prettiest person, but at work. You're like, what are the belly? Yes, man. Click.
I want to say thank you for joining us this morning and letting us know what you're up to. It's for people who are actively looking for a training session, they can definitely go and get all this information there. But I think it's also great for people who feel particularly helpless, like they don't have opportunities to just log on and start to learn something new, just even when you're feeling really, really down about what's happening. It makes you feel more empowered that you're doing something actively to get yourself started on a path back to employment. So I do hope people take advantage of it, and best of luck, and thank you for joining us this morning.
Thank you very much for having us.
All right. And there you have it. Once again, remember that you can find them on Facebook. There's a website, or you can call them and find out about all the training opportunities that you can take advantage of from the comfort of your home, courtesy of BTEC. But with that, we are going to shift gears now, and it's time
for kids time.
That's right. And Dr. Binox is going to be coming in. Dr. Binox is a really entertaining guy, and he teaches us so many important things. We've covered inventions and solar systems, and I don't know what else. But today, we're covering perhaps one of the most important ones that the kids need to understand, and that is pandemics. So we're going to talk about...
What is a pandemic?
Mm-hmm. Let's get into it.